Hi, my name is Pedro Torres-Basanta and I'm in Group 91 with Jeremy Ho, Locke Weekwan, and Vanita Libri. In this presentation, I will explain you the anatomical differences and similarities between the human upper and lower limbs. I will start with a little overview of all these groups of limbs, and then I will go on to the histological, anatomical, and motional similarities and differences between these two groups of limbs. First slide, the proximal muscles of the upper limb are presented. As you can see on the picture, a lateral view of the right arm is presented on the left picture. And on a more general way, we can see all the main muscles composing the upper limb in these two pictures. The main muscles to be talked about are the biceps brachii, the triceps, the brachialis, and the brachioradialis. The first one, the biceps, is used for the flexion of the elbow joint, and it also contributes to the flexion of the humerus at the glenohumeral joint. The triceps, its antagonist, is responsible for the extension of the elbow joint. The brachialis is the muscle that lies deep to the biceps brachii and works synergistically with it in order to cause flexion at the elbow joint. The brachioradialis aids in supination and pronation at the elbow joint. When we look at the image on the right hand side, we can see that the two major muscles in the proximal arm, the biceps and the triceps, are made up of heads. The biceps is made of two heads, a long one and a short one, and the triceps is made up of three heads, the lateral head, the long head, and the medial head. Also, from this view, we're able to see the coracobrachialis, which functions in the upper arm to flex and abduct the humerus. Here, the distal muscles of the upper limb are presented. In both images, we can see the anterior and posterior views of the forearm, and the main muscles in this group are responsible for the flexion or the extension of the wrist, as well as the pronation and supination of the hand. In this image, the muscles that attach the axial skeleton to the humerus are presented. The two main ones are the pectoralis major and the latissimus dorsi in the anterior and posterior side of the body, respectively. The pectoralis major is responsible for the flexion, adduction, and medial rotation of the humerus, while the latissimus dorsi is responsible for the extension, adduction, horizontal abduction, and medial rotation of the humerus. Here we can see the muscles that attach the pectoral girdle to the humerus. The muscles major teres, minor teres, supraspinatus, infraspinatus, and subscapularis comprise a group of muscles known as the rotator cuff. This can be seen on the left-hand side image in both anterior and posterior sides of the body. The rotator cuff functions to medially and laterally flex the humerus and also to provide the stability to the humerus as the arm conducts other motions. On the right hand side, we can see the deltoid, and it's comprised of three heads, the posterior, the medial, and the anterior head. The deltoid has three main functions, one for each head of the deltoid. The anterior head is responsible for flexing the humerus, the medial head is responsible for abducting the humerus, and the posterior head extending it. The proximal muscles of the lower limb are composed into two different categories. The first one, which is responsible for the flexion of it, and the second one, which is responsible for the extension of it. The first main group of muscles is composed of the biceps femoris, the semitendinosus, and the semimembranosus muscles. It is important to note that the biceps femoris is composed of two different heads, the long one and the short one, and it is also important to note that the flexors of the knee are more numerous and larger than the ones at the elbow due to the greater stress that is placed on the knee joint in comparison. On the other hand, there are five major muscles that work to extend the knee, as explained before, and these are the following. The quadriceps, which is composed of the vastus lateralis, the vastus intermedius, which is not shown on the diagram because it is deep inside of the leg, and the vastus medialis and the rectus femoris. The sartorius, which is also the longest muscle in the body, as it can be seen on the in the right image, also acts to extend the knee. Just the same way as with the flexors, the extensors of the knee are more numerous and much larger than the ones at the elbow for the same reasons as given before. The distal muscles of the lower limb are presented on these three images. The tibialis anterior, which is presented in the first image, extends the foot, which is called the dorsiflexion. The peroneus longus, which is the fibularis, everts the foot, and the other three are responsible for flexion of the foot, which is called plantar flexion. Lastly, the muscles that flex and extend the thigh are the following. On the left-hand side of the image, we can see the ellipsoas, which is responsible for the flexion of the thigh. The gluteus muscles is comprised of three muscles, the gluteus maximus, the gluteus medius, and the gluteus minimus. These are the three major extensors of the thigh, which also function to abduct it. Parallels in function can be drawn between ellipsoas and the gluteus muscles of the lower limb and the deltoid muscles of the upper limb. After learning about both upper and lower limb muscle systems, we will compare them following three different criteria. The first one, which is the histological one, is presented here. Before anything, we can learn about muscle fibers. There are two main types of muscle fibers, type 1, which is slow twitch, and type 2, which is fast twitch fibers. These are determined based on the myosin ATPase histochemistry. Muscles of both upper and lower limb are composed of different ratios of these fibers depending on their predominant activities. The muscles of the upper limb are on average composed of type 2 fibers, and the muscles of the lower limb are on average composed of type 1 fibers. Type 1 fibers, as said before, are slow twitch and they're responsible for endurance muscle action, while contrarily, type 2, which are fast twitch, are responsible for more rapid and fast motion. The arms contain more type 2 on average because they do not bear weight on a normal basis, and they're therefore most for their rapid actions. Contrarily, legs are more type 1. In fact, they are load-bearing limbs, and while they do need explosive power for some activities like running or jumping, they need endurance more to be able to support the weight of the body. On another note, the anatomical similarities and differences are the following. The extension of the leg is controlled by quadriceps, which is 4 muscles, and sartorius, while the extension of the arm is controlled by the triceps, which is only 3 muscles. The flexion of the leg is controlled by hamstrings, which is 3 muscles and 1 with 2 heads, while the flexion of the arm is controlled by biceps, which is 2 muscles, and the brachialis. The muscles of the calf and forearm are similar in numbers but are significantly larger in the lower limb because of the high stress they have to load. And the pectoral girdle contains many smaller muscles compared to the pelvic girdle since the deltoids are a prime mover, as explained before. The lower limbs has more muscles in each section due to the greater pressure on the legs, as said before, and they must be able to bear the body weight at all times, no matter what happens, depending on the activity, as well as be able to exert rapid forces for movements. Therefore, the muscles are more numerous to allow for control support as well as motion when required. Deltoids begin all motion of the arm through contraction, hence they are known as prime movers, as said before, and the legs do not require this amount of muscular depth in the pelvic girdle as the leg muscles are always active. When looking at the motional aspect of the muscles, we can see that both the upper and lower limb are capable of flexion, extension, abduction, and adduction, as seen in the images on the right hand side. The upper limb is capable of a much larger range of circumduction and lateral rotation movements thanks to the arms, and the hip joint of the lower limb is not as flexible as the shoulder of the upper limb. The arm is capable of a significantly larger radius of rotation than the leg, as you can experience when moving your arm back and forward, as seen on the top side of the picture, and the leg cannot have its range of motion as the hip joint needs to be more stable as it loads bearing. Tears of the rotator cuff are much more common and easy to do than tears of the muscles in the pelvic girdle and glutes, which shows a little difference between these two areas as well. In order to finish this presentation, I will present a quick summary of the similarities and differences that we studied and talked about through these past few slides. The first point says that both limbs contain multiple antagonist pairs of muscles responsible for both motions of the limbs, just like triceps and biceps in the arm. After, the upper limb contains smaller and fewer muscles as it does not need to hold weight at all times and only needs fast-paced motion exercises. The muscle fibers of each limb differs based on the required use, where lower limb muscles require more endurance and upper limb muscles require more fast-paced motion. Lastly, both limbs are capable of flexion, extension, adduction, and abduction, but the upper limb is capable of larger range of circumduction and lateral rotation. I would like to finish this presentation by asking two questions to our listeners. The first one would be, one, why do you commonly hear about dislocations and injuries at the shoulder joint, but no ones at the hip joint? And then, would a break of the humerus result in the same damage and complications as a break of the femur? I hope that you will be able to answer those questions by listening and reading the slides of our presentation. This is the end of the presentation. Thank you very much for listening and feel free to contact me for any questions or concerns. Goodbye.